my name's Katie. I'm going to be your student nurse from SBSU today. Can I have your name and your date of birth?
Krista Cook, 030293.
And is it okay if I do a head-to-toe assessment on you?
Yeah.
Okay, so first I just want to see if you're alert and oriented. Do you know where we're at?
Saginaw, Michigan.
What month is it?
November.
And who's the president?
Biden.
Now I'm going to do a brief health history. So do you have any allergies?
No.
Any medications or
No.
herbs or supplements you're taking?
No.
Do you have any current or past medical diagnosis?
No.
Do you have any history of surgeries?
Gallbladder removal and 2 knee surgeries.
Do you have any family history of any diseases like cancer or heart disease?
I have cancer and heart disease.
Do you get assessed for those regularly?
Yes.
Okay. What's your pain level today?
0.
Okay. And then, do you know when you're going to the bathroom?
Yes.
Do you smoke?
No.
Do you drink alcohol?
No.
Do you do drugs?
No.
What's your diet like?
Balance, try to eat healthy, get all the food groups.
Good. And do you exercise?
Yes.
Okay.
3 times a week, weightlifting and cardio.
Perfect. All right, now I'm just going to get your blood pressure. Do you have an arm you would prefer?
Sure.
All right, 114/88, so that's normal. Now I'm going to get your pulse ox. Fingers. Capillary refill. 1, 2, 3. Back within 2 seconds. And capillary refill is good on that hand too, and there's no presence of clubbing. So we'll put this on your finger. Then I'm gonna get your temperature. All right, 97.1, which is normal. All right, and your oxygen is 99% right now, which we want it anywhere from 95 to 100%. Now I'm just going to feel your radial pulse and then count that for a minute. Alright, and your pulse was 84 and your respirations were 17. Alright, so now I am going to check your radial pulses. Those are symmetrical. Now your brachial pulses. Those are symmetrical as well. I'm going to inspect your hands and your arms. See some freckles, some redness. This up a little bit. Just some freckles. Do you have any problems with the skin on your hands or your arms?
No.
No? Okay. So now I'm going to have you do some range of motion exercises. Can you just circle your wrists? Alright, so there's a little bit of popping and cracking. Is that normal for you?
Yeah.
Yeah. Okay, now I'm going to feel for muscle symmetry. Okay, your muscles are symmetrical. Now can you shrug your shoulders? Alright, that's cranial nerve number 11, and that's good. Can you act like you're swimming now? Alright, so there's a little bit of popping and cracking in your shoulders. Is that normal for you?
Yeah.
Yeah, okay. So that's normal. Do you mind if I assess your scalp? Let me know if you have any pain or tenderness. Okay. Any pain there?
No.
No. Gonna check your occipital lymph nodes. Postauricular, preauricular, submandibular, submantalis, cervical chain, and then can you roll your shoulders forward? Supraclavicular, and then tissue turgor, which there's no tenting there, so I'm not worried about dehydration at all. Do you have any pain with that?
No.
No. I'm gonna check your frontal sinuses and your maxillary sinuses. And any pain on your face at all?
No.
No. So your cheeks are a little red. You got some freckles on your nose. Do you have any issues with anything on your face?
No.
No? Okay. Do you wear glasses or contacts at all?
No.
No. Okay, now I'm going to check your eyes. Go ahead and look up for me. Okay. Look down. Alright, so your sclera is white and your conjunctiva is pink, which is normal. Now, I'm gonna get that hair out of your face. Alright, now I'm gonna have you look forward and I'm just gonna check your pupils. Okay, and those are normal. Then I just want you to follow my pen light for me. Alright, so that was 6 cardinal fields of gaze, and your eyes are normal there. Now I just want you to touch your nose, then touch my pen light. Touch your nose, touch pen light, touch nose, touch pen light, touch nose, touch pen light. And your coordination is good. Now I'm going to test for accommodation. I want you to just look at my pen light and then look at my hand. Pen light, look at my hand, pen light, look at my hand. And that is normal as well, so your eyes are accommodating. Now I'm going to check for your reflection in your eyes. Just go ahead and look straight ahead. And they are both reflecting well. So do you have any pain with breathing at all?
Mm-hmm.
No? Okay, so go ahead and tilt your head back and I'm going to look up your nose. Okay. Turbinates are present, no polyps or no deviated septum. Do you have any trouble breathing? So I'm just gonna have you close your eyes. Then I just want you to tell me what this is.
Alcohol.
Yep. Alright, you can go ahead and open your eyes. Now I'm going to have you, that was assessing cranial nerve number 1, which is your olfactory smell. We can't do cranial nerve number 2 because we don't have the eye chart. And we already assessed cranial nerves number 3, 4, and 6 when we were doing your eyes.
Okay.
So now I'm going to have you, can you smile for me? Can you frown? Stick out your tongue, move it side to side. Okay, now I'm gonna have you just open your mouth, say ah for me. Alright, your tonsils are enlarged. Is that normal for you? Okay. Now I'm gonna have you clench your jaw. Alright, any pain there?
No.
Okay, so that was assessing cranial nerves number 5, 7, and then 9, 10, and 12. So now I'm going to have you do your cerebellar function, your cerebral function test. I'm gonna have you make an okay sign, then do this as fast as you can, and then put your hands on your lap, and then flip them over, and then do that as fast as you can. Alright, so your cerebellum test is normal. Now I'm going to see if your trachea is in line. I'm just going to feel on your throat. Okay, and your trachea is in line. Now I'm going to feel your carotid pulses one at a time. Okay. Okay, now I'm going to listen with the bowl of my stethoscope. Okay. And there are no bruits present, which is a whooshing sound that would tell us if you have an aneurysm or not. So now I'm going to go to the back of you, and I'm just going to look at your back and then feel for your thyroid. Alright, I'm going to move it to the side. Can you swallow for me? Okay, and then move it to the other side. Swallow for me again. Alright, and that is normal. So your trachea and your thyroid gland are both good. Now I'm going to inspect your back. See some little red dots, some freckles, some red spots. You got some bruising down at your lower back. Is that, you do something?
Probably ran into something at work.
Okay. Alright, now I'm going to check for chest expansion, so just go ahead and take a deep breath. Okay, so your lungs are symmetrical when you take a deep breath, and you have a 2-to-1 ratio for your diameter, which is normal. Now I'm going to have you, can you put your shoulders back for me? I'm going to listen in a half moon shape. If you need a break at all, just let me know.
Okay.
Deep breath in. Two. 3. 4. 5. 6. 7. 8. 9. 10. 11. 12. Okay, so your lungs sound clear. Now you're just going to feel me tapping on your back. It's called percussing. And I'm going to percuss in each of those 12 spots. Three, 4, 5, 6, 7, 8, 9, 10, 11, 12. So I heard resonance, which is normal. Did you have any pain at all while taking deep breaths like that?
No.
No? Okay. Now I'm going to have you lay down. I'm going to cover you up. Alright, and I'm just going to take away your pillow for a second and assess for JVD, which is jugular vein distension. So go ahead and look to your side for me. Alright, and go ahead and look your other way. Alright, and if JVD was present, then I would have you sit up to a 45-degree angle and then assess again, and if it were still there, then I would be concerned about fluid overload, but it's not, so we're good there. Now I'm just going to inspect your chest. Okay. Okay, see some freckles, some red spots again. And then I'm going to listen to your heart valves. There's 5 of them, and let me know if you're having any pain at all. So, clavicle, space, rib 1, space, rib 2, space. This is the aortic valve. Okay, that is normal. Saspra Brui. That one, there are no bruits present. Now I'm going to do the same on the other side. Clavicle, space, rib 1, space, rib 2, space. This is the pulmonic valve. Okay. And no bruits are present there. Okay. 3rd rib, space. This is Erb's point. Okay. Flip it over. And no bruits are present there. Now I'm going to go down to the 4th rib, 4th intercostal space. This is the tricuspid valve. Okay. Listen for bruit. No bruits present there. Now I'm going to go down to the 5th rib, and then the 5th intercostal space, and then mid-clavicular, which is right here. This is the apical pulse. and no bruits are present. Now I'm going to count this for a full minute. All right, gonna cover you back up. I had an apical pulse of 88, which is normal. We want it anywhere from 60 to 100. So now I'm going to go down and inspect the abdomen. So I'm going to pull this down. You pull up your shirt a little bit. Okay. All right. I'm inspecting the abdomen, checking to see if there's any edema, lesions, bumps, bruises, or any obvious peristalsis movement. Okay, and I don't see any edema or bumps or bruises at all. So now I'm going to listen in the 4 quadrants, starting in the right lower quadrant. Okay, I heard 3 to 5 gurgles in each quadrant. Now I'm going to listen to your arteries in your stomach for any bruits. So we'll start with the abdominal aorta. No bruit. Your renal aorta, or your renal artery. Then your iliac. And your other iliac. And no bruits were noted there. Do you have any pain or tenderness at all in your belly?
No.
No? Okay. So I'm just going to percuss in each of the quadrants. Okay, so I heard tympani in all the quadrants. Now I'm going to percuss for the liver border. that's right here. All right, now I'm going to do light palpation. If you feel any pain or tenderness at all, just let me know. Any kind of pain there?
Oh.
I'm gonna do deep palpation. And any pain or tenderness there?
No.
No. Okay, so now next I'm gonna feel your femoral artery. So I'm gonna pull your gown down. And I'll pull the blanket down, keep you in privacy. Okay, now feel for the femoral artery. I found it right there. I'm gonna check over here. And those are symmetrical. Now I'm going to listen for any bruise. No bruise noted. And no bruise noted there. So now I'm going to pull your gown down a little bit, and then I'm going to take the blanket down. Now I'm just going to inspect your legs. So you have a couple tattoos, some freckles, a couple of scars from your surgeries. Do you have any pain with those? No. I'm going to check the bottoms of your feet. Some dryness, but that's probably seasonal. Do you have any problems with that?
Nope.
Okay, I'm going to check capillary refill. Which is back within 3 seconds, and that's normal. Now I'm going to check your popliteal artery. Lift your arms up for me. Those are symmetrical. Now your dorsal pedis pulsus. Those are symmetrical, and then your tibialis posterior. Those are symmetrical as well. Now I'm going to check for muscle symmetry. Okay, your muscles are symmetrical as well. Do you have any problems with your legs at all?
No.
No? Okay. Now I'm going to do a thing that's called sharp and dull sensation. I just want you to tell me which leg it's on and then where it's at on your body.
Okay.
So this is going to be dull.
Okay.
And this is going to be sharp.
Okay.
Okay? So how about that?
Dull left thigh. Sharp right thigh. Sharp left knee. Dull right left knee. Sharp right knee, shin. Left shin, sharp. Dull. Sharp right shin. Dull left ankle. Sharp right ankle. Dull left foot. Dull right foot. I can feel your hand.
Okay. You feel that? Okay. Alright, do you have any pain or do you notice like the neuropathy, or is it just hard to tell between sharp and dull?
When you were on my surgical knee.
Okay, so has that been since the surgery?
Yeah.
Okay, and that's normal for you?
Yeah.
Okay. Alright, so now I'm going to have you sit on the edge of the bed. Alrighty, so now I'm gonna have you just take your hands and I want you to push in, push out, push up, push down. Alright, that's good. And then I'm just gonna inspect your ears too. Do you have any troubles hearing at all?
Nope.
Do you have any troubles with your piercings?
Nope.
Okay, gonna look inside your ears. Okay. A little bit of earwax, but that's normal. Your ears are a little red. Any
Good.
trouble with these piercings?
No, hair just gets caught in them.
Yeah. Little earwax there, but that's normal. Do you have any trouble hearing at all?
No.
No? Okay, so that's assessing for cranial nerve number 8. Now I'm going to have you push in, push out. Okay, so that's good. Now I'm going to have you push in, push out, push down, push up. Okay, so that's good. And then I'll test your patellar reflex. Okay, which those are both good. Now I want you to just do some range of motion exercises with your ankles. Can you just turn that circle for me? There's some popping and cracking in there. Any pain with that?
No.
No? Okay. Can you lift your leg up and like hold it out? Okay, and put it back down. One more time. Alright, good. So I'm not noticing anything wrong with range of motion with your legs. I'm going to have you put your shoes on. If I can get the right way. Alright, have you stand up. We're going to do the Romberg test. So I'm going to have you close your eyes, stand shoulder width apart, and your hands out to your side with your palms out. Stand here for 10 seconds. Alright, so you had a negative Romberg test, which is normal, which means there's no abnormal swaying present. Your balance is good, which is also assessing for cranial nerve number 8. So now I'm going to have you just walk to the door for me. And then walk back. Okay, and then walk heel to toe for me to the door. And then that's far enough, you can walk heel to toe back. Alright, so you can go ahead and sit down. Thanks. So I give you a Braden score of a 23 because your diet is adequate, you exercise, so I'm not worried about mobility, and you know when you're going to the bathroom. So I'm not worried about incontinence or anything. So thank you for being my patient. Do you have any questions?
No.
No?